The tongue is an interesting structure in that it's largely skeletal muscle. It's skeletal muscle that doesn't have an insertion. So the skeletal muscles all enter this tongue and then they just kind of end at the tip of the tongue. So instead of attaching to something and moving it, it actually just moves that entire muscular structure. And we use our tongue for a number of purposes. We use it during speech. It helps us swallow. It helps us mix food around in with our saliva. So it's used for a number of purposes. You'll notice that all these muscles are going to have the word glossus in them. Glossus means tongue. And then the first part of the muscle is just largely based on where that muscle originates. Genio refers to this inside portion of your chin or your mandible. Typically we call this part mental. This is called the genio. Genioglossus. So it originates here and then inserts from under the tongue into the tongue. Notice that if its insertion is largely anterior, it'll pull that tongue anterior. And moving that tongue anteriorly is called protraction. So it protracts. It also helps to depress the tongue. It pulls the tongue down. So when you stick your tongue out at someone, you're using your genioglossus muscle to protrude the tongue from the mouth. The styloglossus helps retract that tongue because usually if you stick your tongue out at someone, you want to quickly be able to retract the tongue before they have a chance to see you. So the styloglossus pulls that tongue towards the styloid process, which the styloid process is buried underneath these muscles here. Recall, there's the mastoid process. Styloid process is under here. It also helps lift the tongue up. So it elevates the tongue as well as retracts the tongue. The third glossus muscle we're going to learn is called the hyoglossus. And that's named after the fact that it originates off the hyoid bone. Here's that hyoid bone buried inside this soft tissue. And the hyoglossus is going to pull that tongue down. So it helps to depress the tongue. So these are all muscles that you use when you speak, when you're chewing your food and mixing that food in with saliva, and then your tongue helps you in the process of swallowing the food. Here's a posterior view of the neck. A lot of muscles of the back have been removed. So this is somewhat of a deep view of muscles. What we're going to look at now are some muscles we've seen before. There's the sternocleidomastoid. But again, most of that muscle you would see in the anterior view. There's the splenius capitis. So there's that bandage-like muscle. So these two are the antagonistic muscles that help you flex and extend as well as rotate the head. There's a muscle that's going to elevate the scapula, levator scapulae. So it's just going to lift that scapula up. We've got a lot of muscles that are going to help move that scapula. Muscles that move the scapula ultimately help us move our arm more. They help increase the range of motion of your arm. There are two rhomboids. There's actually right and left of each of these, but there's two different sized rhomboid muscles in the back. Rhomboid refers to their shape being a diamond-like shape or rhombus. The rhomboid minor is this smaller muscle. The rhomboid major is the larger one. They're both inserting at the scapula, and they help to retract that scapula. They'll also help move it towards the midline, so they'll help to adduct the scapula as well. But those are deep muscles of the back acting on the scapula. Here we have an anterior view. Here we can learn muscles of the abdomen. We can learn muscles of the thorax or chest. We can even look at the deltoid, which is the large muscle of your shoulder, even get into the arm and see the biceps brachii. So here's the deltoid muscle. Deltoid referring to the shape. It's a pyramid or a triangular shaped muscle. I'm sorry. It does a number of things. Primarily, it's an abductor of the arm, so it abducts the humerus at the shoulder joint. But it actually has different compartments to it. So it can also help to flex the arm, flex the humerus, if just this part of the deltoid was contracting. If the entire deltoid contracts, it does more of that abduction. It's going to move that humerus away from the midline, which is called abduction. The large chest muscle is known as the pectoralis major. That muscle is going to do a number of things. What it's best known for is adduction of the humerus. So these two are another great example of antagonistic muscles. The deltoid is going to abduct. The pectoralis major is going to adduct. So when you're doing jumping jacks, these muscles are working to move that arm away from the midline and then back towards the midline. In the kind of armpit area, more of the superior lateral portion of the torso, we see a serrated looking muscle. So here's that sawtooth look called the serratus anterior. The serratus anterior is actually commonly known as the boxer's muscle. When boxers punch, in order to do that motion, they have to protract and superiorly rotate the scapula. So to practice that motion, just pretend like you're punching me, which we probably do want to do that at this point in the semester. But if you practice punching me, that motion of the scapula you're doing is protraction and superior rotation. The serratus again portion is because it looks kind of sawtooth look. Okay, let's look at the intercostal muscles. Intercostal muscles are respiratory muscles. Intercostal means in between ribs. In between each of these ribs, you'll see two layers of muscles. An outer layer called the external intercostals, and then an inner layer called the internal intercostals. These muscles are respiratory. The external intercostal muscle is used every breath you take to elevate the ribs. So these muscles are going to elevate and move the ribs outward. So when you take a breath, you can feel your chest expand outward and upward. That's largely due to the external intercostals. So they're used during inhalation. They contract during inhalation. During exhalation, they're going to relax. The external intercostals are the second most important respiratory muscles. The most important respiratory muscle is your diaphragm. And this drawing doesn't show it because your diaphragm, you would have to look inside and see the floor of the thoracic cavity or the ceiling, if you will, of the abdominal cavity. That divider between the chest and the abdomen is your diaphragm. And that diaphragm is going to contract during inhalation to expand the thoracic cavity downward. So every breath you take, your external intercostals contract and your diaphragm contracts. So that's during quiet breathing as well as forced breathing. But when you're forcefully breathing, you also have to use a bunch of other muscles to expand that chest even larger and to compress that chest inward. One example of an accessory respiratory muscle is your internal intercostal. That muscle, those muscles, run on the opposite angle as the external, so they do the opposite function. If the externals pull these ribs out and up, the internals pull the ribs down and in. We call that compression. Compresses the ribs during forced exhalation. So think about what has to happen when you blow out birthday candles. You really have to force and compress those ribs inward. That happens when you're exercising and you're breathing heavily, or when you're trying to breathe out as much air as possible. So those are important respiratory muscles. The next video we'll talk about abdominal muscles, which are also respiratory. They actually help you during your forceful breathing as well.